Welcome everybody to Wednesday. You made it. Congratulations. It's great to see you here. We have some new faces that have joined us each and every day, so I want to give a special shout out to Nathan and Linda who arrived this morning. Great to have you here. I see Chuck Gerba in the row behind them. Welcome, Chuck, to the conference this year, and many others who are joining us for the first time. So welcome, everybody. My name is Kata Lang. I'm the director of the conference, and I warmly welcome you, along with the Water Institute, to day 3. And so we're going to go ahead and get started. And we've got a full program, so we need to get going. But I do want to draw your attention to, it would be page 45. We lost a champion, a WASH champion in our sector recently, and many of you are already aware. And we have a message from Patrick Moriarty that we would like to play just to remember Katerina and really pay tribute to the work and contribution to the sector that she made. And so I encourage you to read the message in memoriam on page 45, but here's a message from Patrick.
For me, you know, Katerina as well has been a friend, someone I've worked with over the last 10 years, an inspiration, which I think she was for so many of us in the sector. When I first met Katerina, I was, like many people in this sector, I was, I guess, a technocrat. I'm a nerdy person. Like many people, I knew that water and sanitation were very important. I knew that water was important, but I really didn't have any great ideas about how we raised it up the political agenda. And to me, that's what Katerina was. You know, Katerina, with her energy, her diplomatic skills, her amazing network, her ability to light a room up, she just took us to a completely different place. She took me on a personal level to a completely different place, somewhere, you know, that I just wasn't operating. And yes, that was because she had worked for the Portuguese ministry and she was embedded in the UN system, but it was actually just because of who she was. She was someone who was passionate, and she communicated that passion, but also human warmth. And she made water and she created the human right to water and sanitation, but she also, I think, she is largely the reason that we now have things like heads of state initiatives and presidential compacts and heads of state who are embracing water and sanitation. I think her legacy is that we continue, that we double down. You know, at her funeral, talking to people there, and I was thinking, well, is this the end of an era? And of course it is, because we've lost Katerina, but it can't be, because everything that she did for this sector, and I don't even like using the word sector in the same sentence as Katerina, because she was all about getting rid of that way of thinking about things. She was about putting the people at the center and thinking about why water and their human right to water and sanitation was something that we should all unite behind, and we should stop worrying about silos and boundaries and which ministry it was under, but just focus on that, focus on making sure that human right was respected. So for me, her legacy's here. It's what we've been discussing in the sector ministers meeting in Madrid for the last 2 days. It's about continuing that battle, pushing water and access to it and those fundamental human rights right up onto the highest level of the political agenda. Katerina would love to be with you. We all miss Katerina here in Madrid, but Katerina would also say, keep doing the work you're doing. Keep having those great conversations. I know that her spirit was here with us in Madrid, and I'm sure it's going to be with you in North Carolina.
Okay, thank you, Patrick, for those really wonderful words. I think we're all collectively grieving for Katerina de Albuquerque. And I think we're all collectively benefiting from her work and her vision. It's very interesting. I think many of you know her, or know of her, and for those of you that don't know her, as Patrick said, she was a great champion for the right to water, the rights to water and sanitation. I think she taught all of us how to, you know, kind of advance those rights in a very simple way. And for me, I took away very early that those folks that were not benefiting the vulnerable, the reduction of inequalities, taking care of that first as a priority was fundamental. She was our first special rapporteur for the human right to water and sanitation. And with that, she did an incredible job of embedding the rights to sanitation and water into the SDG agenda, and you see that being monitored today. And what was also interesting about what Patrick said, and what I find very interesting, we saw it here in this session on the role of the state, is that many people had thought of water and sanitation as technological issues, right? We need the water engineer. And she fundamentally understood it as political. The water problem is more political than technological, and she pursued that relentlessly. And when Patrick talked about how his game changed, it was about trying to work with brave politicians and good public policies. So that was her legacy at Sanitation, Water for All. And then just on a very personal note, I mean, we all know how energetic and bubbly and passionate she was, and every time she took a microphone, I can imagine her here doing this very differently than I'd do it. She would be up here and in the center of the stage, and someone would have to take the microphone away from her because she would want to really inspire everyone. So let's remember Katarina. And now I would like to shift to something that Katarina would also care very deeply about. And again, as I mentioned, the most vulnerable, the marginalized, and this reduction of inequalities. And I can't think of another group of people, right, that are so integral to advancing what we all collectively want, universal access to sanitation, than this group of sanitation workers. But this group is also so fundamentally impacted by social stigma, by health issues, by accidents, lack of job security, even basic things like inadequate personal protective equipment, and equipment in general to do their jobs. And so there's very complex problems presenting this sector. And so the role of research is very, very important. And so this is the 5th edition that the Water Institute and the Initiative for Sanitation Workers, which is an alliance of many like-minded agencies, are putting on to really promote this notion that sanitation research is important, and to reward that, and hopefully to inspire people to get into this. So with that, I'd like to announce the Sanitation Workers Research Award. And so I'm going to advance the slide. You've just seen that, and you could go to the QR code. And just give me a moment here. So the third place prize that I'd like to announce is the abstract is "Where is my right? Social Security Access for Sanitation Workers in Nepal." And the certificate is proudly presented to Seema Rajuria and Priti Mittal. And Priti, I know you're here, so I would like to congratulate you. Please come on up. And please, maybe you could tell the audience a little bit about the work.
Okay, good morning, everyone. First of all, thank you for the recognition. This award highlights that there is an urgent need for social protection among the sanitation workers. So our research highlights the reality that we cannot ignore. The people who help to keep our cities clean, the backbone of the urban hygiene, remain invisible. We found that most of the sanitation workers are working without safety nets, recognition, and social security. We also found that none of the sanitation workers were enrolled under the Social Security Fund. And vast majority of them were informally employed, thus excluding them from the system they help to sustain. So it is high time that we recognize that the right, dignity, safety, and social protection are not privileges, they are rights. I would also like to acknowledge my WaterAid Nepal colleague and the lead author, Seema Rajoria, who was a very integral part of this research, but she's not here today. And finally, for those who are interested to know more about our research, I will be presenting today, later during the happy hour. So happy to have you all. And lastly, thank you once again, not just for the recognition, but to help keep the rights of the sanitation workers visible on the global stage. Thank you.
Okay, and the second place award goes to a very interesting title, Invisible Hands, Illegal Dumps, Sanitation Work, Informality, and the Legal Paradox in Aleppi Town and its peri-urban areas. And it's by the authors Hera Prasad and Narayanan, and they are unfortunately not here to accept the award, but there's a little video they wanted to share to acknowledge this work. Oh, how does the video work? One more. Oh, yeah.
Hello everyone. I'm Hariprasad VM, a PhD student at IIT Bombay, and I have co-authored this work with Professor N.C. Narayanan. This study is part of the Towards Brown Gold project funded by UKRI, and I sincerely thank the Water Institute at UNC and the Initiative for Sanitation Workers for recognizing our work. Our abstract titled Invisible Hands and Illegal Dumps, Sanitation Work, Informality and the Legal Paradox in Aleppi Town and its peri-urban areas in southern India examines how sanitation work, particularly pit and septic tank emptying, is shaped by informality, social marginalization and legal contradictions. Aleppi, a flood-prone coastal town lacking seaward sanitation and treatment facilities, presents a critical case for understanding the lived experiences of those who fill the gaps left by inadequate state services. Our research, conducted during 2023 and 2024, involved a diverse range of participants. Due to the absence of formal treatment facilities, mechanized pit emptiers often dump fecal sludge in water bodies or open areas, leading to public resistance and frequent police crackdowns. This underscores the legal and moral contradictions of a system that relies on their labor while denying them recognition or support. We argue that sanitation work in off-grid towns goes beyond technical or infrastructural challenges, and it represents a deeply political issue closely tied to questions of labor rights, legality, and state accountability. The study demands urgent recognition of their labor, but not by eliminating informal labor opportunities, but by ensuring dignity, safety, and legal protections. Without such reforms, progress towards SDG 6.2 and SDG 8.8 will remain exclusionary and will perpetuate inequality. Thank you.
And so this is the one we've all been waiting for, the first place prize. It's going to Assessing Health and Dignity Challenges and Evaluating the Financial Scheme's Impact on Sanitation Workers' Healthcare in Bangladesh. And there's a number of authors to this, Mr. Islam, Razul, Nanzinin, Arafat, Oshik, Tasnim, and I'd like to invite, they're not here to accept the award, but on their behalf, I'm going to invite Om Gautam. Om, could you please come up here? This is an incredible piece of work, and maybe you have some insights you can give us on the nature of this work and why it deserved such a wonderful award. So here we go. Thanks so much.
Thank you very much. Thank you. Good morning, everyone. I'm deeply honored to receive this award on behalf of WaterAid Bangladesh colleagues and all the authors listed here. At this particular moment, I just would like to also remember the voice and the struggle of the invisible people in our society. Those people are not other than sanitation workers. Can you imagine a city without a sanitation worker in a low and middle income countries? What happens without them? City can't be clean. Toilet may not be empty. Sanitation value chain might be failed. Health crisis might be everywhere. That will threaten the livelihood of the individual within that particular geographic area. But on the other hand, they themselves are at risk of infections because of lack of training, lack of protective equipment, and also social stigma. In Bangladesh, there are more than 5 million sanitation workers, out of which more than 85% are informal. They work informally. In majority of the cases, government and the national policy, especially the labor and social protection policies, are not linked with their rights. In this particular context, this particular research assess the scheme that was introduced by WaterAid Bangladesh, the scheme called Health Security Scheme, in local term is Sastha Niparto Scheme. It was introduced in partnership with the micro insurance company with different actors into the country. Out of those 5 million that I have mentioned, 21,000 health workers are part of this scheme now. What does this mean? These schemes, if they are enrolled into this scheme, they have to pay at least $2 per year, what they are going to return, out of which there will be a return of $250 equivalent to, that links with their life insurance. If they are sick, they can also get up to 50% of the discount in any of the healthcare settings within those specific geographic locations in 10 different locations in different healthcare facilities in Bangladesh. Colleagues, what I'm saying here, this particular scheme is not only about the life insurance. This is all about recognizing the value of the sanitation health workers and also bringing Sanitation Act, uplifting their existence into the society beyond treating them with dignity and also with respect. With this note, this scheme, the researcher had concluded that this is a more of a scalable and affordable scheme that any sanitation worker can afford, and it can be legalized, their presence into the society with dignity. This particular poster was presented yesterday. I'm sure many of you might have been engaged into that poster. If not, you can also access this through online. And with this note, my great attitude and also to respect to all sanitation workers across the world, and this particular award also goes to them. We should remember them as we also receive this award. Thank you very much.
Okay, well, I hope that motivates and inspires at least some of you to take on the issue of doing more research or initiating research on sanitation workers. So thank you all for that. And I think without further ado, it's really a pleasure for me to invite a dear colleague who is the director of the Environmental Health Group at the London School of Hygiene and Tropical Medicine, Oliver Cumming.
Good morning, everyone. It's a huge pleasure to be here at the UNC Water and Health Conference. I've had a break for a couple of years, but it's lovely to see familiar faces and some new faces. As Bruce said, I work at the London School of Hygiene and Tropical Medicine. I'm a researcher, and I sit in an institution that tends to put health first and wash second, whereas this conference is, of course, the Water and Health Conference. In this session, we're going to try and do that. We're going to start with health, and then we're going to move to wash, and hopefully that will lead to a different discussion, different questions, and different points being raised. Just before we get into it, it's really important that we give you every opportunity to participate in this discussion. So those of you who are here on Monday and Tuesday will be very familiar with Slido. There we go. How to ask questions in Slido. It's really simple. Scan the QR code, put your questions in. There are two things you can do. You can pose your own questions, or you can vote on other people's questions. And we have a crack team of question moderators who are going to pull out the most interesting and the most exciting questions, and they will also try to cluster around themes which emerge in the debate. So we'll hear from Darren, Clarissa, and Jan Willem shortly on that. So the session today, as I said, we're going to put health first, and we're going to put wash second. The title was, I suppose, fairly grandiose and alliterative: drivers, diseases, diplomacy. the emerging global health crisis. So what does this mean? Well, the drivers are the things which are going on in the background, possibly accelerating and making our job more and more challenging and more important. So climate change, also broader environmental change, changing land use, displacement, migration, increasing frequency, intensity, and duration of conflict. Diseases, we're going to be thinking about the shifting burden of diseases, but also the shifting populations of disease vectors. So we'll hear about cholera. We'll also hear about different vector-borne diseases. And then the last bit was diplomacy, which really is a sort of diplomatic or a polite way of building on the session on Monday, which I think was called "Oh shit, what next?" What I would say, and we'll get into this, it's not just about money. Okay, that's obviously having a profound effect on our sector, the WASH sector, but also the global health sector. But it's also about the change in politics. It's about a change in attitudes to internationalism and the international global health architecture and system. So in essence, this session is about big challenges coming down fast, changes that we're grappling with immediately, and the fact that the environment around us is making responding to those challenges more and more difficult. I'm going to start now by introducing our first speaker, but whilst doing that, I'd like to ask the panel, in the interest of time, to come onto the stage, and I'll introduce all of you important people in due course. So Bruce, Claire and Karine, if you could file onto the stage. And I'm going to introduce our first speaker, His Excellency, Ambassador Dr. Asfour Dingamo Kame. In terms of the title of this session, there really isn't anybody I could think of who'd be better qualified. He's got an interest in diseases. He was a minister in the Ministry for Water and Energy. He's actually a seasoned diplomat. He was an ambassador to various countries, including India. He's also a researcher. He has a PhD, so I'm sort of running out of space for all of these titles. But His Excellency, the Honourable, and most importantly, Dr. PhD, Dr. Kame, please take the stage.
Excellencies, distinguished delegates, colleagues and friends, very good morning. It is a great honor and responsibility to address this esteemed gathering on a matter that lays at the heart of human development, the provision of safe water, sanitation, and hygiene services for all. These are not just basic amenities. They are essential foundations for public health, social equity, and sustainable development and economic growth. In my country, Ethiopia, as in many parts of Africa, the WASH sector stands at the crossroads of climate change, public health, and economic resilience. Over the past 2 decades, Ethiopia has made commendable progress in expanding access to improved water and sanitation services. Through government commitment, community engagement, and strong development partnerships, millions now benefit from safe and more reliable WASH services. Yet, significant disparities remain. Rural communities, informal urban settlements, and pastoral regions continue to face chronic water shortage and limited sanitation facilities. These inequalities perpetuate preventable diseases such as diarrhea, cholera, and typhoid illness that disproportionately affect children under 5 and contribute to malnutrition and stunted growth. And some studies in my country indicated that between 60 to 80% of communicable diseases are water-based or water-related or waterborne. So that is a huge amount of statistics you can see. It is preventable when we supply 100% of clean water. The government of Ethiopia continues to prioritize WASH as a driver of health, productivity, and resilience, recognizing that water and sanitation are indispensable to achieving our national development and poverty reduction goals. Climate change is now intensifying the WASH challenge. Recurrent drought, erratic rainfall, and the floodings are increasingly threatening water availability and infrastructure reliability. Recently, we have conducted a study in our country, and because of climate change, the depth of groundwater goes very deep, and in some areas where the already constructed boreholes were dried, some springs are almost dried up, and that exacerbated a very critical problem. So the climate change is one of the major affecting factors, which is almost in that part of Africa. To address this, the WASH sector must evolve from focus on service expansion to one centered on climate resilience and adaptation programs. This requires climate-informed planning, risk management, and sustainable groundwater use backed by strong data systems and a community-led adaptation. One of the most pressing challenges is the shrinking pool of development finance. Global crises from pandemics to climate shocks have reduced concessional funding and the grants that traditionally supported WASH programs in developing countries. Limited domestic resources further constrain progress toward Sustainable Development Goal 6, universal access to water and sanitation. To maintain momentum, we must adopt innovative financing approach, efficiency, and ensuring the external support aligns with national development priorities. From my work at the Ministry of Water and Energy in Ethiopia, I have seen the determination of communities and the local governments who, despite limited resources, continue to expand access and promote hygiene practices. Regionally, through the African Union collaboration on shared water resources such as the Nile Basin and the Horn of Africa aquifers remains essential. The African Water Vision 2025 and the African Union Climate Framework provide a solid foundation for regional cooperation and integration. Globally, through the sanitation and water for all sector ministries meeting initiative just a week before in Madrid, I have witnessed how strong partnerships enhance accountability, mobilize finances, and drive political commitment towards inclusive WASH outcomes. There we have adopted the presidential compact because every country understands that the political commitment to meet the 2030 goal is indispensable. To achieve our shared goals, 3 priorities must guide us. 1, integrate climate resilience. Ensure wash systems are designed to withstand climate shocks. 2, strengthen systems. Invest in institutions, data, and human capacity alongside infrastructure development. 3, enhance cooperation. Foster partnerships among governments, financiers, civil society organizations, and the private sector. As we all know, water and sanitation are foundation for health, education, and economic growth. Every investment in WASH yields multiple returns in productivity, resilience, and dignity. In conclusion, our collective mission is to turn vulnerability into resilience and scarcity into sustainability. Ethiopia's experience and Africa's as a whole show that progress is possible when policy partnership and political will unite together. Let us renew our commitments to ensure that every person, everywhere, enjoys the rights to safe water, adequate sanitation, and the life and dignity that comes with them. May God bless you all. I thank you.
Yeah, thank you, Ambassador. Really bringing these issues to light, both at the level of Ethiopia, but starting to talk also about international cooperation. And if I understood correctly, the 3 priorities are resilience, investment in data systems, and enhanced cooperation, which possibly gets us into the question of financing as well. So thank you. Our next speaker is Dr. Ilesh Jani. He's a medical doctor by training. He also has a PhD from University College London. When I first met Ilesh, he was the Director General of the National Institute of Health, or INS, in Mozambique, somewhat sort of similar to CDC here in the US. He then became the Vice Minister for Health of Mozambique during a sort of very challenging period. And then just recently, his latest job is as chair of the Global Task Force for Cholera Control. So he's going to talk about cholera, which is often taken as the canary in the mine when we know that things are not working, certainly in terms of water sanitation. So Ilesh, hopefully you're there, and we can begin your presentation.
Good morning. First, I would like to thank the organizers for the invitation to speak at this plenary. I'll be talking about cholera and the role of WASH in cholera control and elimination. The Global Task Force on Cholera Control, GTFCC, of which I chair the steering committee, is a broad and inclusive partnership. Our partnership unites over 50 institutions worldwide, including NGOs, UN agencies, and academic institutions. GTFCC synchronizes partner and country efforts to support a coordinated, multi-sectoral approach to cholera prevention, control, and elimination. Our work includes research, technical, policy, and on-the-ground support to combat cholera. Importantly, we support countries to develop national cholera plans. Currently, the activities of the GTFCC are guided by Ending Cholera, a global roadmap to 2030. So, where are we with cholera control in 2025? The map shows the data on reported cholera until mid-October this year. Only this year, more than 500,000 cases and almost 7,000 deaths have been reported, mainly in Africa, the Middle East, and South Asia. Currently, 6 countries, all in Africa, are in acute crisis of cholera. Cholera remains a disease of inequity, affecting those who are poor, who have been displaced, or who suffer the consequences of war and climate change. We estimate that every year there are 1.3 to 4 million cholera cases and 21,000 to 143,000 deaths. It is shocking that 1.3 billion people are at risk of contracting cholera globally. The Ending Cholera, a global roadmap to 2030, is implemented along 3 axes. Axis 1, on early detection and quick response to contain outbreaks. Axis 2, on a targeted prevention strategy in cholera hotspots, which we now call Priority Areas for Multi-Sectoral Interventions, PAMIs. Axis 3, on GTFCC support and coordination of human, technical, and financial resources. Please note that Axis 2 includes both WASH interventions and oral cholera vaccine, with WASH interventions being key for the long-term sustainability of the response. By 2030, the roadmap aims to eliminate cholera in 20 countries and reduce cholera deaths by 90%. The 2030 roadmap places a unique importance on WASH, both in emergency settings and in the long-term context. In emergency settings, for example during an outbreak, WASH interventions save lives and halt cholera transmission. In the long term, WASH interventions constitute the only sustainable solution to eliminate cholera. An important concept in the roadmap to 2030 is the focus on the PAMIs. These are geographical areas with high to moderate transmission where multi-sectorial control activities can be targeted. This also means that WASH activities can be targeted to these areas to accelerate cholera control. As indicated in the map, a growing number of countries is mapping their PAMIs, which we believe will have a positive effect on cholera control and elimination. Acknowledging the presence here of policymakers, practitioners, and researchers from over 700 organizations, in this final part of the talk, I wish to make 3 calls for action to the WASH community. First, the cholera and the WASH communities need to collaborate more intimately at national and subnational levels. This collaboration can be guided by national cholera control plans. An increasing number of cholera-affected countries have these plans in place now. Water, sanitation, and hygiene are highly placed in cholera control plans. In many instances, a substantial proportion of the plan's budget is for investments in WASH infrastructure and activities. It also happens that the national water and sanitation sectors have, rightly, their own development plans. However, frequently, these plans are not synchronized. This is a truly missed opportunity for collaboration and synergy in time of scarce resources. Second, we need innovative and cost-effective WASH approaches, especially to target PAMIs. Classical WASH infrastructure investments might take decades and cost millions that countries do not possess the fiscal space for. To keep alive our ambitions of cholera control and elimination, we need effective and sustainable solutions to deliver water and sanitation to all PAMIs in cholera-affected countries. Big challenges call for greater ingenuity, and we need to step up our game as 2030 approaches fast. Third, I wish to invite all present institutions of the WASH community to formally join the GTFCC. The GTFCC is a broad and inclusive partnership, and we want and need to work closer to the WASH community. We need to coordinate better our actions and synergize to deliver water, sanitation, hygiene, health, and well-being globally. So please get in touch and join the GTFCC. Together, we can end cholera. Thank you for your attention.
Thank you, Ilesh, and thank you for joining us from Mozambique. There's a lot there which I think our panel can sink their teeth into. It's very striking for me in terms of putting health first and water second was the figure which Ilesh showed that ran case management to vaccination to WASH. And I think maybe in the WASH community we would flip the order and we'd start with the prevention, the bread and butter prevention of water sanitation, then we'd go to vaccination, and then if we're failing on those two fronts, think about effective case management, but we'll get into that. Our final speaker, and I'm going to give you all advance warning, you may want to put your fingers in your ears for the first 5 seconds of this presentation because it's literally dynamite, or at least explosives. Our next speaker is Dr. Richard Allen. Richard is the founding, or was the he is the founding CEO of the Mentor Initiative, and he's now the chair of the board of directors for Mentor. He doesn't look old enough, but he tells me he has 4 decades of experience around emergency public health and applied research. So yeah, please, Richard.
Well, what a wonderful room full of people. As I walked here this morning from the hotel, I was thinking, what an extraordinary volume of experience we have between the brains and the lives represented in this room. And there's never been a time we needed that more than now, because we have entered an extraordinary year. We're well into it. We've never in human history had so many wars. We've quadrupled since the end of the Second World War, and we have 120 armed conflicts ongoing at the moment. And if you look at that map, which is generated by ACLED, and you overlay it with where the endemic tropical diseases are that I'm going to talk about, it's an almost ideal fit: conflict and tropical disease. And it results in over 1 million vector-borne disease deaths a year. I'm going to eliminate the ones transmitted by monkeys and bats and rats, and just focus on some others. It also is a year where we recognize that in my 39 years, not 4 decades quite, of working in emergency settings for tropical disease control, we've seen a rapid escalation of both scale and number of natural disasters, with huge consequences for those affected by them in terms of how isolated they are and forced from their homes and very difficult to protect. We've also seen this eye-watering escalation of forced displacement, which has now reached a level whereby we're not far off half of the US population forced displaced from their homes, living on average for 5 years in camps, only 3% of them returning every year, and 60% of them roughly ending up in urban slums. Hold on to that point because it's very significant when it comes to disease. How do you get disease, all of these vector-borne diseases? Well, you have to have the right insects. You have to have the right places for them to lay their eggs and rear their young. They're very particular. Some like rainwater, others like containerized water, others like quite dirty water. Sandflies like cracks in buildings. They like cracks in floors and walls. They like domestic waste. Filth flies, by name and by nature, they like feces, and the worst form of domestic waste. If you have all of those things, plus the basic climatic conditions, and this is what's been changing, so that the pathogens and the insects can grow happily, and you have unprotected humans, then you start to get disease if you have pathogens present as well. Most of the world has all of those factors. Some have 4, including most of Europe, and North America has all 5. We'll come back to that. And of course, for vector-borne disease, you need no one delivering an effective response, despite knowing the risks. So I'm going to just pare it down to these 5 criminals, the biggest killers in wars. 3 mosquitoes, and sandflies and filth flies. 2 of the mosquitoes have invasive species that have come in during my working life just in the last 2 decades. And if you ask which ones are affected by the work you do in WASH, all of them. And they're all affected by the change in environment the conflict brings. And it's very, very demonstrated. If you pick any one week in a WHO report, you'll see that the vast majority of disease in that report is vector-borne. So it's no surprise that if you start to look at vectors that are transmitted because they like to live in rubble, well, sandflies love rubble, and the conflicts we have across the Middle East are where sandflies, but also insects like mites, are escalating at a very rapid stage, very rapid speed. Close proximity of people having to live in the base of the rubble or cramped together in camps brings them in very close contact with the vectors that transmit disease. And the disease is very real. And leishmaniasis, our lessons from Syria show that it can escalate very, very quickly into very large scale, affecting every family in whole communities, despite having 1,000 people spraying 4 million people's homes across the war zones in Syria. That's why we've been spending the last few years researching this, spatial repellents, and very excitedly publishing results this year, just earlier this summer, showing that spatial repellents used by families themselves can absolutely bring down sandfly biting and halve disease in a way that's so easy, it's amazing. Feces and waste, the other site that filth flies like to settle in, rear their young. What a choice. An incredible diarrheal disease burden, we've heard already about it. And if we want to deal with that better, because that burden of disease is vast still, we have to get very serious about these sites. We have to get serious about feces and about waste management, areas which in humanitarian aid are often rather neglected, but that's where flies live, and flies, believe me or not, are responsible for mechanically transmitting up to 26 different enteric pathogens, including cholera. And that's why you struggle sometimes to control it. But we can control flies very easily in these emergencies using insect growth regulators applied onto feces and waste. We'll come back to that. If we do, we'll stop the contact that flies have with children and the death rates even more effectively than you're doing just with sanitation interventions alone. The other, containerized water, where one of the mosquitoes likes to live, has been transmitting dengue, chikungunya, Zika, and yellow fever for centuries. But in the last few years, since the 1960s, dengue fever has escalated from 9 countries to 136. This is the fastest growing communicable disease in the world. And unlike COVID, it doesn't go away. It just gets worse. It has no cure, no field diagnostics, and no effective field usable vaccine just yet, though a few are in line. And it's been escalating in the humanitarian sector for a long time. In my working life, ripping through Africa from east to north and far into Europe now too. Open surface water, malaria, you're all very familiar with that. You've assumed it's the health community's responsibility and stayed largely out of that. That's been a mistake. Wash interventions sometimes increase malaria because if you generate surface water of any sort for 10 days or more, then that vector will use it very effectively, and people die very quickly within 8 hours. We made fantastic progress against malaria for 15 years. we halved malaria deaths. But then we realized we had not been halving malaria deaths in conflict zones, in the hotspots. We've been halving them in easy-to-reach countries which had less challenging settings, and nets worked very, very well for doing that. But when we started looking at the numbers much more clearly, the numbers went up again by 2017-18. We've got a 40+% increase in deaths globally, and they all sit in 11 African countries across that tropical belt, 8 of which are in conflict, 8 of which have populations like this, where nets simply don't work, they don't fit, and where indoor residual spraying hasn't been used enough. There are many challenges, including some vector changes in the way where and when they want to bite you, including some of changeovers of active ingredients, including an invasive mosquito too. But what we have discovered is that spatial repellents, the same as we used in Syria, also bring down malaria by about 30%. Not as good as leishmaniasis, but great nevertheless because they're super easy to deploy and very effective to be used by people. And this is ATSB. It's a trap. You nail it onto the outside and inside of houses, and that also brings down insect vectors, both malaria vectors and Aedes vectors, very, very effectively. This is the malaria vector that's causing a nightmare, though. It's not like the other malaria vectors, it's like Aedes. It acts and lives in the same way as Aedes mosquitoes. It maximizes the sort of water that we generate in human populations, in urban settings. It can breed just like Aedes in anything as small as a cap from your bottle, and everything in between. So when you look at these sort of water containers, some of which you give out in humanitarian settings, open buckets, jerry cans that don't have tight-fitting lids, water tanks by Oxfam. I started life with Oxfam in the emergency in the Rwanda genocide, so I know these tanks well. Unless it stops a mosquito from entering, mosquitoes will enter it, lay their eggs, and the eggs will stick to the walls of the vessels, all of them. But we can control it really easily because we've got new technology which has been approved by WHO. It's a simple disc which you add into water, any of the drinking water containers. It's safe for humans, and it will stop all insect development in the larval stages. And it stops them for 6 to 9 months. That technology should be in use by all of you now in every WASH program. If you talk about Culex mosquitoes, which transmit Western Nile, which we had the first case of in England in May, Western Nile from Sudan breeds in these settings, the insect, but so do Aedes and the invasive Anopheles. But again, you can control them using insect growth regulators like Dimilin. So they're easy to apply, and when you take these new technologies and you put them together, you integrate them and you start to put them with standard WASH interventions, you get something which can really change the impact that we achieve in emergency settings. And we've got policy now driving those new tools and the use of them and telling you how to integrate them. The policy and guidance that is coming out of WHO is practical, thanks to Bruce's work. And it really tells you how to use new technology with old WASH techniques. We have a malaria manual that's just been released this August as well. That also integrates those new technologies, puts them together, and again shows you how to apply them in emergency settings. If you want to know more, my email's there. Thank you very much.
Fantastic. If you could sit next to the minister. Great. Wow, 3 wonderful presentations setting out the challenges. I think interestingly for me, a little bit different to some of the presentations I've seen over the years at UNC, the sort of starting point being diseases or disease vectors sort of raises different questions in terms of what should the WASH sector do about these, and some quite different approaches I think there in Richard's sort of presentation, and things maybe that the WASH sector is not doing, which is potentially sort of not helping or even exacerbating issues. So the first part of this was to hear from people speaking more from a public health angle and to lay down the challenges. The second part of our session is the panel who are representing the WASH sector. So we have, of course, the World Health Organization, Bruce, who I think you've already seen today, but the head of the WASH unit at WHO. We've then got Claire Chase, senior water economist at the World Bank, and then lastly Karin Gallander from EWAG in Switzerland, sort of formerly a researcher, then in the world of policy, and now back into the world of research. So having listened to these challenges, I'd like to now turn to the panel and ask for some reflections. Hopefully my mic will transfer as I go. Yes, very good. Great, so I'm going to start with you, Bruce. Obviously, health is not an unusual or alien concept at the World Health Organization. What do you take from these presentations? You're a sort of isolated group within the World Health Organization.
Well, I mean, I think that first, I mean, both Eilish and Richard, I think, really challenged everyone to think of themselves as health workers. I mean, you said it from the beginning, right? Like, put health first, but it's not like I think you have to make compromises, but I do feel like there's meaningful things that all of us can do to integrate health objectives into the work that we do, right? Whether it's policy or practice. I mean, maybe on the cholera side, what I took away was Eilish really spoke about these national cholera plans. And I think what's interesting about that observation was he did kind of highlight there was this kind of lack of, he called it like synchronization between an NCP and some of the WASH objectives. And I think, you know, my sort of diagnosis, and I've talked to a lot of people about this as well, is that just this whole notion of, is it the national cholera plan that many folks might feel like being kind of led by a health initiative and potentially even a vertical disease program, is it being adequately integrated into like WASH policy? And I think Richard's plea was a very similar one, right? It was like he's talking about vector control and, you know, this very issue of, you know, if we're looking at climate resilient sanitation and drainage and, you know, better containerized water management, all these kind of things I think are possible to do if people put on a little bit of a public health kind of cap. But as far as policy goes, you know, you need to, we talked about these PAMIs, right? Just cholera hotspots, basically. And are these actually included as, you know, targeted targets in a WASH policy? Are they there? Like they're in they're definitely there in the National Cholera Plan. Is cholera-related investment actually put together and tracked, you know, in a WASH policy? And I think mostly, and quite importantly, like, is there the disease targets, right? Like, is actually, you know, we talk a lot about service coverage and we talk about functionality in the WASH group. That's our metrics. But is anyone having a serious conversation in a WASH joint sector review about like the fact that, you know, cholera is rampant, or that, you know, you've got vectors on the rise and some of these very concerning emerging ones, invasive ones. So I mean, I think there's the other, sorry, I just wanted to say one other thing about this, because Eilish mentioned this humanitarian kind of short-term WASH emergency response. And then there's this development angle as well. And I think that all of us know about the importance of WASH systems and the complexity of that, and maybe the long time frames associated with that. But WASH systems, that kind of work needs to be in a national cholera plan. It does. So, you know, Eilish said join the GTFCC. I'm sure Richard is wanting our community to join some of the work that he's concerned about. And then my kind of feeling as, you know, where I'm sitting is, well, they should join the WASH community, and they are here, right? And I think it's like Eilish is, you know, has a lot on his plate, Richard has a lot on his plate, and they're here talking to all of us. And so I just think that, honestly, like, I feel like I have a WASH and a health hat on many different times, but there can be a greater response, I think, among us, I'll call us the WASH folks, because I think we are always thinking we're doing things for health, you know, and that actually can be done a little bit more structured and targeted way.
Bruce, just to follow up, obviously the World Health Organization has sort of been through interesting sort of few months, quite challenging few months. As I understand it, there's been some restructuring internally, which has led to sort of kind of changing titles for sort of divisions and directorates. And I think you now sit within environment, climate change, One Health, and migration, which, if you like, are many of the buzzwords that we've heard here. In those changes, do you see, these calls for sort of moving away from sort of narrower interventions, thinking more broadly about environmental health, WASH stepping up to the plate in terms of the public health aspects of climate change? Do you feel that things are going in the right direction at the moment in terms of this agenda?
Well, I mean, I think on the one hand, there's a practical side to all this. Certainly looking inward at WHO and many other organizations, you get these mergers and you tend to get maybe cost savings because you have, one director that oversees 4 groups instead of 4 directors, that kind of thing. But we are seeing like a joint department of, NTDs and malaria, for instance. They are now joined. So the person that used to do diagnostics for 2 NTDs is now doing them for like 22 diseases or something like that. And I think we're seeing similar things like within WASH. So, I mean, it's integration. And I know that I'm not the person that's going to say integration solves everything, because I do believe we have to spend a bit of time, going deep and getting, kind of our own community of practice. But I think that's the way the world's going to go. I think we all have to broaden our horizons and do a little bit more homework at night to get conversant in other people's issues. I'll say this, it's a bit, talking to a very senior person in a government that'll remain unnamed, but they talk about, okay, well, the WASH, or the health folks, the health ministry has to do something about this cholera outbreak. And, this is a WASH person, right? So it has to be both.
Yeah, great. Sorry to put you on the spot, but that's my job. Claire, so Claire, World Bank, I think people obviously think about money. But if we could sort of maybe think a little bit about the sort of policy issues here as well. So there's been a lot of work in the World Bank around fragility, around responding to crisis, how you get financing to places sort of quickly. What are your reflections? What do you take from this? What's the World Bank doing about these issues?
Thank you, Ali. Wow, I'm stressed out. That was pretty intense, especially the second presentation where we had some bombs going off while people were speaking. So I think we're all processing this, but that's the reality. But I think, crises, they take multiple forms, and we have to talk about them with that perspective in mind. We can talk about climate shocks being one crisis, the conflicts that we're seeing, the health emergencies, the epidemics. But the fact is that many of these are predictable in where and how they occur. So the hazards, the natural disasters, these are geographically patterned. And now with better data, seasonal forecasts, we can generally predict where these are happening. We know that the risks are following the triggers, right? The flood, the extreme events, often preceding the cholera outbreaks. So I would argue that many of these crises are in fact just recurrent system failures that are happening in predictable places. And importantly, the exposure and the vulnerability to those crises are also a factor of the systems and the institutions that are in place. So I think partly in response to this routine nature of crises that we are seeing, the World Bank put together, rehashed a approach to preparedness and response to crises, a toolkit, a financial toolkit to be able to better respond to these recurrent crises. And that was partly based on what we learned from the COVID pandemic. When the pandemic hit and we needed to rapidly mobilize financing, we were not able to do so. It took long time to restructure projects, to get the financing to where it was needed, that we're looking at different outcomes. And we realized that with this context that we're facing, the poly crisis, as we sort of term this, we need a new approach. So that crisis response toolkit is now enabling us to provide flexible financing for when these crises do hit, enabling us to have in place the coordination across partners, for example, bulk procurement now with UN agencies, that we can rapidly mobilize some of the supplies that are needed to respond to these crises. And importantly, that crisis preparedness and response toolkit also really emphasizes this systems strengthening. So even with the best financing, if you don't have the systems in place to utilize that financing when it comes to respond to the crisis, it's not going to be effective. So I think, you know, we know the next crisis is going to come. The question is whether the systems are going to be ready. And I think cholera really illustrates this perfectly, and how we're financing cholera helps to illustrate this challenge. So cholera is a waterborne disease. We've known this since the mid-19th century, but we keep treating it as a health emergency. Every time there's a cholera outbreak, I get an email from our health colleagues saying, what can we do very quickly in water to respond to this? And I'm like, oh yeah, we should have thought about that. Like, you know, we should have been investing in this over the past decades so we wouldn't see this problem. So, see, I think that, you know, we term it a health emergency. Health is not equipped on its own to respond to this. We know that the sustainable water and sanitation, the reliable systems need to be there. The surveillance data, of course, there are critical inputs that are needed from the health sector, but I think we need to stop thinking of this as a health emergency. And I think, yes, like putting the wash first, making that commitment. And, you know, just an aside, I think we always hear this from, and I think it came up last year in our panel, we always hear this, you know, wash, you need to do something. And I think that, look, let's actually do something. It's time for us to do something because people are expecting us to do it, right? We can't keep saying health needs to do this because it's a fundamental water and sanitation problem. I think, and I just wanted to talk briefly about how we're thinking about responding to, or let's say preventing cholera. So the World Bank, as part of our new water strategy, we've also been working together with our health practice to think about how do we take a more preventive approach to the cholera challenge. And specifically also, how do we finance cholera prevention? Because the way it's been working, as you all know, it's utilizing massive amounts of funds to respond to this in this emergency mode. So I don't think it's about creating a cholera silo. It's really by leveraging that broader system strengthening, the sustainable water and sanitation systems, also importantly working with the health sector to strengthen that health emergency prevention, preparedness, response mechanism, as well as just the more broad health system strengthening. So that, and as was raised by Mr. Jani, that we're focusing on including those cholera hotspots as part of these broader system strengthening investments. So we get to the place where every water quality investment is helping us to prevent cholera. Every expansion of safely managed sanitation services is helping us to prevent. And we're seeing that this is working. So we have a case in Malawi where, following the outbreak of the cholera in Malawi, in Lilongwe, the World Bank worked with the health and the water ministries to identify those places where cholera had been most of an issue, and put in the systems, these sustainable water supply sanitation systems. And it's not a experimental result, but they did show that deaths went from 500 prior to that intervention to 5 following the subsequent outbreak. But I recognize that this can be frustrating because we're not putting out the fire. We don't feel like we're putting out the fire because we're not getting that emergency funding, and it will take a bit longer, but it's the only way that we can tackle this is by chipping away at it, dollar by dollar. I still think we need that crisis finance in place, and we need those emergency systems because I don't think we're talking about bringing these types of systems to refugee camps. I mean, this is always going to be a challenging context to work in, but I think by working together with both of these sources of finance and mechanisms of approaching it, I think we can start to see good results. So.
Well, thanks, Claire. There's a huge amount there. Really, really interesting. I'm going to move to Karen, but I'm just going to say with our crack team in the front here, I think you're arriving at some themes or some questions. I'm going to go straight to you. I think it's Darren to get audience questions after Karen. Okay. So yeah, you said, Claire, you're sick of the question, what can we do very quickly? The important stuff takes a while. So talking about doing things quickly, we'll talk to the research community where things don't tend to happen quickly. But Karen, you were in research, you trained as a researcher, then you were working for Swiss development corporations in the sort of policy world, and then you've recently come back to research. I'm interested, what did you learn from that? Has it changed your motivation as a researcher? And in terms of all of this stuff, what kind of research is actually going to shift the needle? Yeah.
Yes, thank you, Oli, for the question. You're asking what kind of research is needed, and I think there is really room for more operational and pragmatic research to address the challenges we are talking about. And when I say operational research, I mean research that is fully embedded, integrated within development and humanitarian programs. And when I say pragmatic, I mean research that adopts methods that enable the generation of rigorous evidence, but that are appropriate to work in complex environments and evaluate complex interventions. And one specific example I'm thinking about is the project we worked on when I was at the London School of Hygiene and Tropical Medicine, this impact evaluation of water supply infrastructure improvements in the town of Uvira in Eastern Democratic Republic of the Congo. And I think that project was quite special and illustrative of that kind of operational pragmatic research because it was initiated by the French Agency for Development and Veolia Foundation. And those two funders who were investing in water infrastructure involved a research team from the very beginning, from inception of the project. And this enabled the team to set up data collection from the start. In the end, I think to date there is over 10 years of data collected at this study site through cholera surveillance. And this full integration between implementation of a development/humanitarian intervention and a research team really helped generate evidence that is I don't know if actionable is the word, but that is very relatable to relevant to implementation. So this is one example. I think another contribution of this project that I would like to highlight is the contribution to strengthening skills that are useful for research, but also useful for protecting public health. And I don't think that research is leveraged often enough for this direct impact level. And as researchers, we also do not always have the right incentives because this will not be accounted for in publications. But in the example of Uvira, at our study site, from setting up cholera surveillance with the local health authorities using rapid diagnostic tests in 2015, 2016, it has now evolved also under the the leadership of Andrew Asman at Johns Hopkins University and Jackie Nee at the London School of Hygiene and Tropical Medicine in more recent years. It has really evolved to having a laboratory which was built with funding from the research projects that has capacity to perform tests such as culture-based and PCR for cholera diagnostic. And I think this is a really nice example of how research projects and research resources can be leveraged to strengthen capacities that are needed to address the challenges. Yeah, I think if I have time for another reflection.
Perhaps, but let's see what the audience, and then if we have time, we'll come back. Thanks, Carrie. Thank you. Really useful sort of point there, and then illustrated with an example of a cholera hotspot and operational research in that hotspot. Darren, over to you. If we can sort of short, sharp.
Okay, certainly try to be short and sharp, Ollie. We've got two questions clustered, one around integration and then about specific diseases. The integration questions are multi-part. Let me just quickly summarize those. So one question is, we're talking about coordinating between cholera and WASH. Where is the housing and planning sector in this discussion? Another is about multi-sectoral coordination is needed but takes time and resources. Given reducing ODA and increasing stresses, what are the practical ways to be more efficient? Another integration question about what effort is the WASH sector making to leverage health sector financing so as to address WASH through integrated programming? There was also a specific question to the Minister here about the Africa Water Vision and the ways in which that might ensure cooperation and financing. So that's the first cluster around integration, housing, time and resources, ways to be efficient, and leveraging health sector financing. Then on the specific diseases, there's a question which we thought was interesting here. We've been referring to diseases such as dengue and leishmaniasis as neglected tropical diseases for 25 years. Is it helpful to rebrand them as proto-pandemics? And then the last on specific diseases, vaccine-preventable diseases, including many with WASH links, have not been mentioned. Can the panel comment on polio, rotaviruses, etc.? Is misinformation a vector?
Great. Very clear, but lots of questions there. What I'm going to do is I am going to jump around the panel and maybe ask people to respond to specific points. Richard, you were sort of nodding about maybe we need to rebrand neglected tropical diseases. What do you think about this proposal?
Yep, totally agree with you. It's an absolute nonsense. One of the shake-ups we should have done was shake up our whole historical way of thinking. We sit today in 2025 with the biggest opportunity for the WASH community that it's ever faced, probably since the 1800s when it was responsible for getting rid of plague and cholera in Europe. And I don't exaggerate, the new technology that I've described, if brought in and used by the WASH community now, could knock out 16 diseases in every response you go to. Those 16 diseases aren't neglected tropical diseases because they're small or difficult to respond to. They're neglected because for the last 20 years, more than, we've over-focused on malaria and we've left it to the health community and we've looked at a magic bullet response. And in the meantime, not only have the other diseases ramped up enormously, all the flaviviruses being transmitted by Aedes, but also we've allowed another malaria vector that acts just in the same way to come in and start to ramp up the risk too. One of the greatest opportunities you have for tackling that is to say, if I put these things into my WASH package now, I can show value for money that I haven't been able to do for decades. I can show to the donors that still are responsible and funding support that we can make real impact at very large scale on life and limb just by adding in very simple to use, lightweight, low cost, easy to use tools, and at the same time hand the power to the beneficiaries rather than require international teams to deliver them at a high skilled level. But we're not talking about tropical diseases that are small, we're talking about tropical diseases that add up to at least 1 million deaths a year, most of which are occurring just in these humanitarian crises because of the overlap of tropical disease endemicity with conflict.
Great. The next one I'm going to pick up, and I'm going to go to Claire. Under the sort of headline of integration, this cluster, there was this great idea that we might enter into, as the WASH sector, into the health sector, because there's all this money that we could leverage. I don't know if you have any experience of this, maybe the health compacts, the water compacts. Are there rich meadows full of development finance over there in the health sector?
So health financing, yes. I think well, there's a lot of potential synergies, I would say. I think over the years, I've become much more cautious about health sector financing WASH service delivery. I think that is tricky. We know it's very complex. It's a service. It's not, and I guess this whole terminology of WASH package and our whole NGO past volunteer sort of WASH kind of mode that we talked about last January gets us into this mindset that we're providing a package, right? Something that we can give to the community and they deal with it. I think when we're talking about a service, it becomes much more challenging to delegate that to a sector which has its own services to deliver. Now, there are ways to, I think there are ways to compartmentalize. There are some aspects of the WASH service that the health sector does very well. I mean, I think this whole service of vector control is, you know, anytime you're sort of getting into the community and doing behavior change and doing sort of household motivation, I think community health workers have that capacity to support those kinds of activities. But I think when we're talking about a sustainable water service or a sustainable fecal waste management service, that is I think it's a very sort of technical service that you know, needs the professionalization around it and needs the sector human resources support around it. I think one of the things that I've always struggled with is in the health sector, you have these massive health sector workforce. We don't really talk about that in the water sector, right? We rely on communities a lot, but we do need a professionalized workforce to deliver services. So I think it becomes it becomes quite a challenge to delegate as we get more sophisticated and as we get to the safely managed levels of service. Now, that being said, we have so many synergies across water and health. I mean, to the point that you can't even distinguish them. Certainly, all of the work on pandemic prevention, preparedness and response, the pandemic fund, the global financing facility for every woman, every child, all of these are working on, they're financing outcomes that WASH is directly contributing to. So I think those opportunities, sorry, I will stop because I could just go on.
So people are trying to, no, Claire, please finish.
Yeah. No, so I think those are opportunities to leverage the finance. I don't think there's any pot of gold. But I think if we can find effective ways to join up with those financing sources, then we can leverage that.
Yeah, and we need to be creative on financing. So I think absolutely all these. Bruce, before I go to you, I need to make an announcement, and then Ilesh, who's in Maputo, wants to jump in. There's been a rumor that at UNC there have been cases yesterday and the day before of queue jumping for lunch. So people allegedly have been leaving plenary sessions a little early to get ahead of the queue. I've had a word with the caterers. They're watching out for this. The session will finish at midday. Anybody spotted leaving early, I will radio that through to the dinner queue. Ilesh, over to you, and then I think I'm going to give the last word to the ambassador. Yeah, please, Ilesh.
Yeah, thank you. And I promise I will not jump the queue to lunch. I think the word synergy is spot on what we need to do between health and the WASH sector. And my personal experience when I was Vice Minister of Health in Mozambique, I worked on a national cholera control plan together with my counterpart in the Ministry of Water and Civil Works and Housing. And we worked on it for several months. You would have one meeting in my office, the next meeting in her office, and so on. And at the end, actually, most of the budget in the plan is for WASH. But you know, the question there was how together we will try to find the pot of gold to fund the work. Thank you.
Thank you, Ilesh. We started 10 minutes late, so we are running out of time rapidly. Bruce, you've got 10 seconds. Yeah?
Well, just this question about accessing money from the health sector, I feel like our health sector colleagues just feel like the WASH sector has a pot of, is it on? Just hold it closer to your mouth. On now? No. Oh, Claire turned it
off.
Claire, she's saying.
That's your 10 seconds, huh?
Yeah, now I don't have anything to say. No, just the fact that I think there's this perception that WASH is this big confusing sector with lots of money, and how do we access that? That's from a health sector perspective. And I think that there is a complexity to sort of, if you sit outside, because I'm confused, I think it's not like an easy sector, maybe it isn't a sector, but trying to figure out how to get into it. And I think we have to find a way to break down the barriers so that welcoming some of these health perspectives into joint sector reviews and into WASH planning, honestly, because I think there is a fair amount of funding there for development WASH, and it's probably possible to target it existing funding in ways that make sense, for the most vulnerable, with some of these health, with cholera and so on.
Great. Could you give us maybe one takeaway, something you've heard today, it's a little bit different, that you might take back and discuss with your colleagues and the government of Ethiopia?
Thank you, Chair. First of all, I would like to congratulate the presenters who have presented a very critical issue, and also thank researchers for their outstanding works. As you are well aware, the humanity this time is passing through very critical situation. As you know, problems are here and there. And wars are there, displacements are coming, then the climate change is there, that exacerbated the WASH sector problems. Again, the health issue is becoming day-to-day problem. There are a lot of diseases which are coming out and becoming outbreak, and creating disease. So this is a really very critical situation. So in this case, we have to collaborate together, number one. Number two, cooperation is very important. Number three, synergizing the efforts is one of the areas we have to look at, and integration of all efforts is very critical. And of course, the political leadership in each country should look at the problems, where the problems are evolving. So unless and otherwise we cooperate and work together, problems are almost going beyond even our borders. Now the communicable diseases are becoming really, international. If it is outbreak in some area, it goes to another places. So the climate change is bringing all those problems as a complication. We in Ethiopia tried to, just to give the experience, we tried to harmonize and integrate all efforts in one WASH national program. There we brought 4 major government actors together. We tried to make one plan, one budget, one reporting system in the WASH activities. So that means the Ministry of Water and Energy is there, the Ministry of Health is there, the Ministry of Education is there, and the Ministry of Finance is there, which is already financing this. So we prepared a plan together with our development partners. They put all those resources in one basket. And now we are looking to bring also the private sector and the civil societies who are already working in the country here and there. So by integrating those efforts, we already brought very good results in the sector. So working together is very, very important.
Thank you.
That is our experience, and I thank you for your attention.
Thank you. So a wonderful summary, and I think that message of working together. I'd like to thank our panel. Richard in particular, he's flying on to DC to meet senior people, shall we say, at the State Department. So hopefully you can carry some of this discussion to that meeting. But yeah, thank you, Bruce. Thank you, Claire. Thank you, Karine. Thank you, Ilesh, for joining online, and thanks all of you.
Thank you again to the really great panelists. And Richard, are you around for lunch? Can people connect with you before you take off? Okay. Please connect with Richard and connect with him about the interventions that he was mentioning before he heads off. I just have three main announcements I'm trying to prioritize as we are going into lunch and lunch sessions. Reminder that there are 3 lunch sessions today. The Technology and Innovation Showcase, which is in the Sunflower Room. The continuation of a lot of our USAID, former USAID folks, and MWA and IATMO are leading discussions at lunch as well. And then we also have another one that's slipping my mind. Josh's water jobs. So please join one of those lunch sessions, get in the lunch line, take your food to those lunch sessions, and they're going to get going at 12:15. So please get into lunch. Today is the conference dinner. It starts at 5:30. You will need a ticket to get into dinner. So if you paid for dinner and you don't have your ticket, please go back to the registration table, and they'll be happy to get that for you. We'll have the Zoom photo booth. Business Connect will be sponsoring our happy hour, our drinks. And of course, Mapleview Farms for some ice cream at dinner time. And then AY Young will be performing a short set. So please join us this evening. We look forward to seeing you at 5:30 when the doors open. Again, thanks to Ollie for leading a fantastic panel, and thanks to all of our guests and Minister for joining us today. Have a great Wednesday, everybody, and thanks for joining us. Oh,
Sister,
yeah. Are you ready for lunch? We're going to get lunch.